Hello everyone, my name is Vilam. I'm a second year osteopathic medical student and I'm also a research intern at the Center for Research on Addiction and Brain Health. And today I would like to present on how osteopathic manipulations can be used for COVID-19 prevention. So a quick overview of the presentation. I will first go through the definition of osteopathic medicine, then what OMT is, what it's used for, then how we can use OMT for COVID-19 prevention, and then finish it off with some current statistics. So what is osteopathic medicine? It is defined as a branch of medicine that values hands-on care, whole person approach, and emphasis on the interrelated unity of all body systems. And osteopathic physicians especially pay attention to muscle and joint movements, as well as utilizing different types of pressure and resistance in their treatment. And the four tenets of osteopathic medicine really reflect the essence of this profession, and we believe that the body is a unit, the person is a unit, body, mind, and spirit, and the body is capable of self-regulation, self-healing, and health maintenance. Structure and function are reciprocally interrelated, and rational treatment is based upon an understanding of the basic principles of body unity, self-regulation, and the interrelationship of structure and function. So the next question is, what is OMT and what do we use it for? So OMT stands for osteopathic manipulative treatment. As osteopaths are very hands-on, we use hands to diagnose, treat, prevent illness and injury. OMT has also been proven to help with conditions such as asthma, sinus disorders, carpal tunnel syndrome, migraines, menstrual pain, etc. And the main goals of OMT are to treat structural and tissue abnormalities, relieve joint restriction and misalignment, restore muscle and tissue balance, and promote the overall movement of blood flow throughout the body. So the most important information in this presentation is how we can use OMT for COVID-19 prevention. So the main targets of using OMT in this scenario would be to address firstly the thoracic inlet. As we can see from this illustration here, it is the junctional region between the structures of the root of the neck and the contents of the thoracic cavity. And the important structures passing through the thoracic inlet include the trachea, esophagus, thoracic duct, nerves such as the phrenic nerve, which innervates the diaphragm, the vagus nerve, and the recurrent laryngeal nerve that innervates the larynx. Also, the lymphatic vessels, arteries and veins also pass through the thoracic inlet. And the next target is the lymphatics, and then it is the autonomic nervous system. To promote the inner health and optimally balance the sympathetic nervous system, we would look for somatic dysfunctions in the thoracolumbar region. So this region right here. And to balance the parasympathetic nervous system, we will look for dysfunctions in the cranial and sacral regions, specifically somatic dysfunctions that may affect cranial nerves 3, 7, 9, 10, and sacral roots 2 to 4. And then lastly, we can also address breathing and positioning. So first of all, I would like to start with breathing. So one of the techniques would be box breathing, also known as square breathing, which is a technique used when taking slow, deep breaths, and it can heighten performance and concentration while also being a powerful stress reliever. And this technique can be beneficial to anyone, especially those who want to meditate or reduce stress. And the next technique would be the thoracic inlet. So thoracic inlet release is also a major step in addressing lymphatic flow. Its function is to release restriction, internal lymphatic drainage into the subclavian veins, and it's always the first step in lymphatic treatments. And as we can see from the slides, it can either be done by an osteopath or it can be done at home by yourself, especially during quarantine time. And again, all the links to the videos are included in the description box. And to continue our discussion on lymphatics, another OMT technique that would be helpful for COVID-19 prevention is the ENT sequence, as we can see on the right. This helps release myofascial restrictions and the common ear, nose, throat congestion. And the only caution is we have to be aware with patients with painful lymph nodes or TMJ. And lymphatic pumps can be applied to the thoracic cage, abdomen, feet, and legs. And pumps are used to facilitate fluid movement or immune responses in patients with varying symptoms and disease states. And these pumping techniques can have been demonstrated to increase lymphatic flow in thoracic duct, and mechanical pumping has been shown to increase the lymph uptake in rats in recent studies. And furthermore, the application of these lymphatic pumps have been shown to boost antibody responses to vaccines and significantly increase secretory IgA. Next one would be the spinal immobilizing techniques, or we also call rib raising. It can improve motion of the spine, maximize respiratory motion, and provide a stimulating effect for the SNS. It also helps to restore normal rib cage motion, which facilitates venous return and lymphatic drainage. Rib raising contraindications would include rib fracture, spinal cord injury, and surgery. And lastly, I would like to touch a little bit on positioning. So proning is the process of turning a patient with precise safe motions from the back position onto their abdomen, so the individual is lying face down. And it is especially beneficial in compromised COVID-19 patients with or without ventilator needs. And the position would allow for better expansion of the dorsal or back lung regions, and would improve the body movement and enhance the removal of secretions, which may lead to advances in oxygenation. So lastly, I would like to address some statistics on OMT usage for COVID-19 patients. So first we would look at positioning or proning. So as we see the PaO2 FiO2 indicator right here, this ratio is the ratio of arterial oxygen partial pressure to fractional inspired oxygen, and it is a clinical indicator for hypoxemia. So the main takeaway from this graph is that oxygenation significantly improved during ventilation in prone position. And the graph on the right illustrates the cumulative number of patients with COVID-19 treated with OMT. As we can see, this red circles here, and the number of OMT sessions provided to those patients will be the triangles up top, and the bars on the right axis will show how many DLTouch.net members, which is an organization. This is this graph was taken from their website, and will show how many members report each week would be the green bars, and how many provided and how many of those physicians actually provided OMT to COVID-19 patients each week. So that would be indicated by treating clinicians, would be the blue bar right here. And so the main summary is that OMT is not currently widely used by clinicians in a hospital setting yet, and this could be due to restrictions of the hospital setting and certain risks associated, since OMT has not been greatly considered as a major treatment method comparing to traditional medications or mechanical ventilations in COVID-19 treatment. And so that concludes my presentation on OMT and COVID-19. These are my references, and I hope it was an informational presentation for everyone. Thank you for listening.